Welcome back to another episode of the Skinfluence Podcast. I'm your host, Dr. Dustin Portela.
And I'm Austin Lee, physician assistant at Dr. Portela's practice.
And today we're talking all about body acne. Backne.
The Backne.
Buttne. Is that a word?
Buttne's a thing. Chestne.
Yeah. Chestne.
All the...
We are just making up words today. But you
medical.
Get the idea. Acne that appears on the back, the chest, the back side.
Yeah.
And we're going to talk about the differences and the similarities between that and regular acne and some of the different ways that you might choose to treat it or things you can do to avoid it.
Yeah.
So let's start with why we get body acne.
Well, there's a lot of different reasons why we get acne on areas that are not the face. We have oil glands elsewhere. Mm-hmm. So one of the main causes of acne is oil production, too much oil buildup. And so we have oil glands on our chest, our back, and our butts.
Yes, we do.
And so anywhere you get that oil that's getting occluded or plugging up your pores, it can lead to acne.
Yeah, anywhere you have sebaceous glands, these are the oil-producing glands. Mm-hmm. They're attached to a hair follicle. So if you think of the hair follicle coming out, the oil gland plugs into the side of it like a freeway on-ramp.
Yep.
And then they come out the same hole. And some of those have terminal hairs like whiskers or scalp hairs. And some of them are just fine vellus hairs that you don't really see. Right. But anywhere where you have a sebaceous gland, you can get acne. And we're prone to getting them in the areas where we have more sebaceous glands, which is obviously the face, the back, the chest, the back side. We have fewer concentration of oil glands on the arms, the extremities, the legs. But you can, still get it if you have oil glands there. But usually, we don't have them on the palms or soles of our feet. So if you get something that looks like acne there, you're probably dealing with something else.
Totally. Now, a lot of people have the question, I get asked in clinic, is my back acne different than my face acne? Are there differences? Are they the same? Are they linked together?
They certainly can be linked together, and oil glands are responsive to the androgen hormones in the body, primarily testosterone.
Yeah.
And when testosterone interacts with them, it causes them to produce more oil. And this is why we see acne develop in the pubescent years when people start going through puberty, because both men and women start to have a rise in testosterone. And kind of a fun fact is that women, from a strict concentration perspective, have more testosterone than estrogen.
Right.
But obviously men have very little estrogen and a lot more testosterone. But estrogen is a much more potent hormone, so you need smaller levels of it to have a bigger effect.
Right.
But on a strict, like if you just measure it in the same units, testosterone is higher in women, but it's still much lower than in men.
Interesting.
So when you have the hormone influence on the oil glands, and then you have some other type of inflammation in the skin. Mm-hmm. Those pores can get plugged up, and then you'll start to accumulate oil underneath the skin. And if that's happening in oil glands that are deeper in the skin, you'll get more deep, painful cystic lesions. If it's happening very close to the surface of the skin, you might get papules and pustules or comedones. But usually there has to be some inflammatory onset to that. That can be a poor diet. That can be mechanical friction, stress, or trauma to the skin. It can be products that you put on that occlude the pores. So it can happen in a very similar manner with the back and the face, but the treatments are sometimes different because the oil glands on the back, the skin is so much thicker. They lie deeper in the skin,
right.
And the same topicals that might clear your face may not clear your back.
Right. And a lot of times, some of that inflammation comes from just all that pressure of the buildup of the oil and debris in that pore or a hair follicle will cause it to rupture underneath the skin, and that also will elicit a lot of inflammation. That's where you get those deep, painful, cystic-like bumps that show up on the face and on the back. But
if you're prone to getting back acne, you probably know it's much harder to pop them than it is things on your face, because you're trying to squeeze something out that is way deeper in the skin, and it's more likely to rupture under the skin, leading to inflammation and scarring and potentially abscess formation.
Sure. So what are some common mistakes that you see that your patients may be doing that are making it worse, or things that you're seeing that you counsel your patients to do to try to prevent or lessen the body acne?
So for the body acne, I still talk about diet with my patients because I think that having a clean diet will help just whole body inflammation.
Totally.
I see it a lot in gym goers, people who are using public gym equipment And, oftentimes you're wearing very thin tank tops or shirts where you've got the sleeves cut off.
Yeah.
I like to do that to show off the guns,
Yeah.
but then you just have more skin that can come in contact with the machines.
Yeah.
And you really can't trust that other people are properly wiping down the machines. Even if you see them go over and do a quick swipe, how much stuff did they get on there? Did they cover it all?
Yeah.
So gym equipment is a common place to pick up extra bacteria. And then, if you're like me and you're benching like 6 plates, that's not true.
Dang.
Have you seen that meme about Miss Frizzle from the Magic School
Oh,
Bus?
yes. Where she has like 3
She's
plates
got
on each
4
side.
plates.
Oh, 4 plates.
She's got 4 plates, so she's benching 405.
Narrow grip.
Narrow grip.
I see.
No spotter, nothing. And it's like Miss Frizzle is definitely on the
Flat
juice.
back.
Flat
oh,
back.
she's on
yeah.
the juice.
That's a little sidetrack, but yeah, Miss Frizzle was on the juice,
Oh,
guys.
she was repping out too.
But when you're doing weights, also you're putting more stress on the skin if you're pressed up against a machine, whether you're doing leg press or bench press, or you're on a machine and you're doing pec flies, something like that. So
Yeah.
it's just friction. If you're wearing tight fitting clothing, if you're not washing the clothing after your workouts.
Yeah.
And I'm certainly guilty of that, where I have like my gym bag and I'll throw my shorts and shirt in there. And I'll go to the gym the next morning and be like, I didn't grab new stuff. So I'll just wear the same clothes
Totally.
again. They've got sweat on them.
I've been there.
Those are the types of things that I talk about with my patients that I think are common mistakes that may lead to more acne.
Yeah. Another thing that I'll find that I've done in the gym too is when I'm doing things like leg press or I'm sitting up against a bench, when I'm resting, I stay seated up against the bench. I
Yeah.
don't air out my back or anything like that. And
Yeah.
I'm in a wet, sweaty shirt,
Yeah.
and I'm not doing anything to kind of alleviate some of the pressure, get airflow, try to dry that out.
Try to dry it out, yeah. A lot of times, if you're working out in the morning, you're showering, you're going to work, that's a great habit. But, if you're working out at the gym and then you're going to wear your gym clothes and you're going to go run errands and that clothing, that sweat is staying on you longer, you're not cleaning the skin, that's another thing.
Yeah. And then people who wear backpacks, vests, things like that all day, and they're getting a little hot and sweaty, all that occlusion and friction there is going to help help football players. We see that a lot when they're wearing their pads and things like that will cause some back acne because they're just sweating and there's nothing they can do about it.
Yeah.
So we have to try to help them manage that.
I've worked with a number of police officers who get chest and back acne because of their plate carrier. They're wearing the bulletproof vest. And I remember one time, this was a guy that was newer on the force, and it was really bad back and chest acne.
Yeah.
And he asked us to write a letter to his supervisors that he could get a new vest because he was wearing one that had been in the force for a long time. He was a new guy. He got one that just gets handed down,
Sure.
And he's like, this thing is gross and like it's hard to clean. And so like I'd love to get a new one because I think this is contributing. And it clearly was. It followed the pattern of where that sat.
Yeah.
And it was just that heat and that friction all day long.
Right.
So the other thing, when we're talking about the gym is there are people who may take exogenous hormones. So they're pinning themselves and at home or in the gym locker room, they're taking testosterone or steroids, legal or illegal. And those types of things that interact with the androgen receptors can really increase acne. And that's a common thing. I've seen it so much on social media where people who are in the bodybuilding community who are not natural, they're taking steroids, they get severe acne. And I've seen terrible scarring happen from that.
Oh, totally. Also, HRT, hormone replacement therapy, as we see in the older population, you may start to do that. I have noticed some back acne showing up there. Something that I hear a lot in clinic is, and I get asked a lot, is, do I have fungal acne?
Yeah.
And it's something that's definitely online. It's talked about. I see it talked about online. Is fungal acne an entity that you see, or is that something that is just kind of thrown around to try to maybe you're not responding to typical medications and we're thinking of that it may be something else?
By and large, my experience is that fungal acne is overdiagnosed on social media.
100%.
People think they have fungal acne, but they're just not responding to the treatments that they're using, and they need something different. Classically, fungal acne is what we call monomorphic papules. So when you have acne on your face, you have a deep cystic one here, a little white pimple here, you have a blackhead here, and each bump is at a different stage in evolution. Whereas fungal acne tends to be very similar, monomorphic, meaning all of the bumps look very similar, lots of small white or red bumps. Fungal acne is much more likely to be itchy. And so that's one question I ask when people have a lot of back acne is this itchy? If it's not, it's less likely to be fungal acne. The bumps tend to be smaller. They all look the same. And then it often comes much further down the back, whereas regular acne is often over the shoulders and the upper back. Fungal acne, if we're starting to come down onto the lumbar spine, that really triggers my thought process to think more about fungal acne.
Sure. And treatments, I would assume you treat it differently.
You do have to treat it differently because the antibiotic that we use to treat acne, whether that's an oral antibiotic or a topical antibiotic like clindamycin, the fungus is just not going to respond to that.
Totally.
We need topical ketoconazole, selenium sulfide, pyrithione zinc. Those are the topical treatments. And then sometimes we'll give patients oral fluconazole, which is a common antifungal pill that's really well tolerated. So the treatments are different, the presentation is different, and people on social media think they have fungal acne far more than they actually do.
Yeah. And a lot of times the fungal acne is a little bit of a misnomer because we're treating, there's probably fungus there, but also a yeast that grows in our skin and in the oil glands called malassezia that builds up in those areas. And the fluconazole treats that, the ketoconazole shampoos and things like that treat that. But yeah, it has a classic presentation that we see of those monomorphic small pinpoint papules and pustules. So things to look out for is if you have those types of things, okay, something to consider. But not all Backne and Chestne is fungal. And if it's not responding to typical treatments, typically the back and the chest don't respond as easily to typical treatments or it takes longer to respond. So jumping straight into the fungal acne realm may not be as beneficial as it is online, or as prevalent as it is online.
Often misdiagnosed. So. But let's transition into a little did you know. I wanted to bring up something that we do not see in the clinic very often, but it is kind of the most severe form of back acne or chest acne, and that is acne conglobata.
Oh, yeah.
Acne conglobata. Acne fulminans is another variation of that. And conglobata is just fun to say.
It's fun to say.
I don't know exactly where it comes from, but acne conglobata is deep cystic acne that is incredibly painful. There are often multiple sinus tracts, so the acne bumps are connecting underneath the skin. A ton of pus, and the inflammation level is so high. These patients also get arthritis of the sternal clavicular joint. So it's often that we'll see the sternoclavicular joint right here at the base of the throat get inflamed and tender. And sometimes it's out at the by the scapula on the clavicle. So it affects those joints. They can get severe back pain as well. And this is a very rare presentation. It can just happen. It's much more common in men than it is in women, more like boys versus girls, because this is often presented in teenage years. And in rare circumstances, this can be triggered when somebody starts Accutane.
Yep. Yeah.
So,
I've actually seen that happen once where a patient had come in with severe nodular cystic acne on the face. And I had let him know, hey, we'll see how the first month goes. We're going to start you at a low dose, but we may need to do a course of prednisone. And within a couple of weeks, he came back and it was starting to form almost like a plaque of acne across his face.
Looks like a keloid.
It looks like a keloid. So we started prednisone and it calmed it down, and we did prednisone and Accutane for a little bit. But
yeah, you can't stop the Accutane because it'll just happen again. You got to power through, and we modulate that inflammation with steroids. And there's a really well-defined protocol. The outcomes are great. I have to do this once or twice a year. And we usually do it proactively because you can kind of look at the patient and get an idea of are you at higher risk? Because they usually are presenting with more severe acne at the beginning, and they're just likely to have that happen to them. So we may give them low-dose prednisone they take every other day during the first month.
Yeah.
So,
well, I have a did you know.
Let's hear it.
Did you know that the back has the most oil glands per square inch than any other place on the body besides the face?
I would have assumed that the face was the highest.
Yeah.
But yeah, that makes sense.
The back's right up there with it, apparently. And that's why we see the Backne.
That's why we have Backne. So as we come back to the show, let's talk about treating and preventing body breakouts and what kind of topical routine do you discuss with your patients?
So lots of times when they're breaking out on the chest or back, I don't see a ton of blackheads. It's usually more inflammatory by nature. So I will typically have them on a topical anti-inflammatory and antibiotics, like the clindamycin lotion. I may have them do that morning and night, twice a day. If I feel like they're working out a lot, there's maybe a bacterial component to it, which is often the case for people working out, sweating a lot, or if their job is they're outdoors, they're manual labor, they're sweating all day. I'll have them do Hibiclens in the shower to the back and chest, just to try to kill off any extra bacteria. But typically, I'll treat it with a oral antibiotic, the doxycycline, which we've discussed in our other acne podcast. I usually try to start at a once a day dose, but sometimes just to get it under control, we'll do twice a day for a little bit and then come back down to once a day.
Yeah, very similar approach. I like to use a benzoyl peroxide cleanser.
Benzoyl peroxide is great.
CeraVe makes a good one. It's a 10%.
Yeah.
I don't like 10% benzoyl peroxide on the face. It just is pretty drying, but people tolerate it really well on the back. And it's like their acne foaming cream cleanser or something like that.
Yeah.
It's a 10% benzoyl peroxide. They do make a 4% BP that I like better on the face.
Sure.
And then if you're using clindamycin, which is that topical antibiotic, they work really synergistically because the acne-causing bacteria can easily become resistant to clindamycin if that's used alone. But if you're using a benzoyl peroxide in the same day, so I mean, you don't have to put them on
at the same time.
Right at the same time, but you can wash with the benzoyl peroxide and then put the clindamycin on after the shower or at night. And there's no documented resistance of acne bacteria to benzoyl peroxide.
Right.
So this really helps also to prevent the resistance to clindamycin, and you get better efficacy by using both of them together than either one of them individually added up.
Sure. And since you brought up the topic, there's a large social media push right now to go against benzoyl peroxide.
Yeah.
And just to clear it up, we are proponents for benzoyl peroxide. So benzoyl peroxide can, under extreme conditions, break down into benzene. Usually that takes a lot of heat.
Yeah.
So you have to put it on and then be out in this sweltering heat for a prolonged period of time for that to happen.
But even that, it is not generally enough. So under the conditions that benzoyl peroxide can generate the benzene chemical, it's got to be at like 140 to 160 degrees for several hours. And so as long as you don't keep your benzoyl peroxide in the oven, then you're not going to be exposing yourself to benzene.
Yeah.
And we are certainly not advocating that you get exposure to benzene. And if there's ways to reduce your risk, that's a good idea. But if you are driving on, congested roads on your way to work and back, you will get exposed to benzene from the exhaust of the cars.
Exhaust fumes, yeah.
If you sit around a campfire and you're cooking s'mores with family, you will get a fair amount of benzene exposure.
Yep.
And most of us don't think about those risks, but we all take risks every day in our life. And because of the context of it, the benzoyl peroxide products have really become a bad name.
Yeah.
And a lot of this is driven by the Environmental Working Group, which is an organization that, in my opinion, really cherry picks the data that they use when they make product recommendations. And they use a lot of fear-mongering tactics to drive consumers towards brands that work with them.
That makes
sense.
So
there is financial incentive for brands to get the EWG certification, which they have to apply for. They have to submit money to go through that process. So not everything is just cut and dry. The EWG is not a strictly altruistic organization.
Sure.
They make money, and they make money by creating a class of products that they don't recommend because those companies may not play their game or may have ingredients that when you give it to a rat at 10,000 times the dose through the mouth, it may have caused some problems.
Sure.
But you'll never undergo those experiences in human use. And then they play nice with these other companies that have to apply to get the EWG certification.
Right.
So there are conflicts of interest in just about everything, and we're not asking you to take just our word for it, but to understand the full picture and then make more informed decisions.
Sure. Yeah. If you see posts online saying don't go see a dermatologist because they recommend benzoyl peroxide, that's not a good recommendation.
It's misguided. So
yeah.
Now, other products that you can put on the back, salicylic acid, I like on the back as well. Salicylic acid is a beta hydroxy acid. We've talked about it many times on the podcast. It can help to get down in the pores and decongest them. And this is a product that can come in sprays, which is really convenient if you can't shower right away.
It's hard to reach the back
or
sometimes.
on pads. But there are sprays. Differin makes a spray you can just hold and spray on your back to help, kill some of the bacteria and get down into the pores a bit, remove some of that oil and sweat and dirt that accumulates.
Yeah. One thing that sometimes I'll recommend to people who just can't get anything on the back is, I know I'm not always a big proponent for loofahs because they're just a breeding ground for bacteria, especially if you're not cleaning it properly. But sometimes you get the loofah on the stick. You can get body washes, things like that, and just gently rub the area. Sometimes they'll have like a soft cloth side, so you're not aggravating that back knee. But sometimes a lot of my patients use those to be able to apply things on the back. And then there's the old, if you're trying to apply a cream, you get a wooden spoon and wrap it in saran wrap and you get a little medicine on it, and it rubs in real good.
In just about any pharmacy, you can get a medicine applicator.
Yeah.
It looks like a back scratcher, but it has a pad on it, and you can replace the pads. You put your medicine on there, and you just rub it on your back like a back scratcher.
Yep.
And that's usually what I tell patients to do if they don't have a significant other or somebody that they live with that can help. And then I joke all the time with my patients that, all right, I'm going to write you a prescription to give your wife more back rubs with lotion, or your husband, like this is what needs to happen. So,
yeah.
But yeah, I mean, I like that tip about the loofahs. I use a loofah in the shower. Like I see dermatologists say don't use loofahs, or sometimes estheticians. I'm like, what am I supposed to use? Like, that's what I use, and I get a new one every month, and they're like 99 cents. So I use a loofah.
Yeah.
I'm not anti-loofah.
Yeah, and you can clean them with HibaCleanse. You can just get it all in there and just wash it out really easily. I use loofahs occasionally too. I'm not anti-loofah, but
I use them every day. I'm going to go on the record as being pro-loofah.
You're a daily loofah use.
I am.
Good.
I am a daily loofah user. The words I never thought I'd have to say.
Yeah, and proud of it.
Yeah, absolutely.
Okay.
So, and then you talked about the oral doxycycline. That is something that we can use. And this is because those oil glands are deeper in the skin. The topical products just don't penetrate to that depth sometimes. And if you got bad back acne, you may never see satisfactory treatment from just topical products, cleansers, and leave-on products. And the oral antibiotic does a great job. In some cases, we'll do Accutane. I have several patients right now where they're on testosterone replacement therapy. One of them was on it for a long time, and then the acne developed after like 2 years. There's no rhyme or reason.
Oh, really?
And we'll do low-dose Accutane where they are going to stay on TRT. They don't want to come off of it. They're going to still deal with acne. If you're on TRT, it's a much higher chance that acne will come back after you discontinue a full course of Accutane. So we'll do a low dose where they take it maybe twice a week. They don't get dry skin, but it's enough to keep those oil glands from being too overactive.
Yeah.
So there's a range of options. I also talk about probiotics with my patients, their diet, lots of things.
Yeah, I've been talking more and more about diet with my patients too, and that has been a beneficial thing for a lot of them because they realize I'm eating a lot of processed foods. So, any other lifestyle hacks that you use?
Well, clean those gym clothes frequently.
Yeah.
The tight-fitting gym clothes, or if you're wearing sports bras, yoga pants, whatever it is. That's why I stopped wearing yoga pants.
Yeah, I still wear yoga pants.
But those types of things, just the compression and the shearing forces on the skin, although it doesn't cause pain, but it may increase your risk of acne. So I wear just loose-fitting tank tops when I go to the gym. But
yeah, if you're getting stubborn acne and it's not going away, or you've followed some of the recommendations we've made over the counter that you've tried, benzoyl peroxides, actives like salicylic or glycolic acids, and nothing seems to be helping, go see your dermatology provider, because we have lots of things we can do to try to help combat that back acne, the chest acne. We can accurately diagnose, is this a fungal type acne or a yeast, or is this just your regular occlusive oil gland type acne, and we can help you.
And that's especially important if you're starting to have scarring. And I have, I've seen a number of old patients when I'm doing skin checks, and they have scarring all over their back from acne as a teenager. Some of it was before Accutane was even available.
Yeah.
But we want to try to prevent that, because then it impacts your, self-confidence. If you want to take your shirt off when you're going to the pool, or you're wearing a bikini without a back, something like that. You just, want to help you have the best skin possible. And we can do that.
Totally.
So as we close out, we want to introduce you guys to our product of the week. And this is specifically for back acne. It can be used on face acne as well. It's the Dean Skincare Clear Choice Acne Pads. This is a 5% glycolic acid, which is an alpha hydroxy acid, and a 2% salicylic acid, the beta hydroxy acid. 2% is the highest that you can get in an over-the-counter formulation. And there's 60 pads in here. I have a lot of my teenage patients who are in athletics buy those and keep them in their gym bag.
Yeah.
So after practice, they can wipe their face down. They can wipe their shoulders down with it if they can't, go shower right away.
Totally. I do the same, especially with my football players who are taking the pads off. I say, clean the helmet out with it, clean the face off the back, all of that. So I think they're great.
Guys, thank you for joining us for another episode of Skinfluence. I'm Dr. Dustin. You can find me on all social media channels at Dr. Dustin Portela, Dr. Dustin Portela, with one L.
That's good to specify. You can find me on TikTok, Instagram, and YouTube at Austin Lee, PAC.
And if you found this episode helpful, share it with a friend, and we'd love it if you left us a 5-star review on any podcast platform that you prefer to listen on. Of course, the episodes are also on YouTube if you want to see the video version as we talk about these conditions and the products that we are using. And all of the products that we talk about are going to be linked in the podcast show notes or the YouTube video description. And we'll see you next time when we talk about the skin barrier.
Fun.